to our dentistry practice. My name is Dr. Evie, and I am honored to be your dentist for this evening appointment. May I ask who we should thank for referring you? Oh, okay. It was online, one of our Instagram ads. Okay. I'll be sure to let our social media team know. All right. And if you don't mind me asking, why did you decide to leave your previous dental practice? I see. Yes, we do treat a lot of patients that have had a history of dental anxiety. As you know from our Instagram ads, we do specialize in gentle dentistry here at this clinic, and we love working together with patients as teammates, as equals, as partners to make sure that you're getting the proper oral care that you need to live a happy and healthy life with the best smile possible. Okay? So, that being said, when was your last dental appointment? Okay. I noticed a little bit of hesitation when I asked you that, and I just want to reassure you that in my practice, we strive to create an absolutely judgment-free zone, okay? So anything that you say today, any responses to any questions, please know that you will receive no shaming from me, okay? I just want you to feel free to be as honest as possible in our time together so that we can make a plan together on how to keep your mouth nice and happy, all right? So, if you don't mind me asking, what concerns are you hoping to address today? Absolutely, okay? Yeah, we can absolutely work on that together. My top priority is making sure that we're meeting any goals that you have for yourself, okay? Wonderful. So, I'm going to take a look at the x-rays that my assistant took of you earlier, alright? So just hang tight while I take a look at those. Alright. Okay, just quickly flipping through that. That looks good. I need to take a look at the document. Looks good. Okay, so all things considered, you do have very beautiful teeth, and I'm really excited to get to work on them today, alright? I did notice that there were a few fields missing from the intake form that you filled out online, and so I was hoping that we could address those together today. Does that sound okay? And like I mentioned, you don't need to feel shy or embarrassed. I'm not going to shame you about any of the responses that you provide today, okay? It's just very helpful to have this in your history and in your file so that we can look back on it and have a better sense of what will work best for your needs, alright? Okay, so if you would just do me a favor and let me know, how often do you smoke or vape, if at all? Okay. Okay. And how often do you consume coffee or black tea? Okay. So both of of those things I just mentioned, the smoking, the coffee and the tea, they can have a staining effect on the teeth. So that's very helpful for us to know when we are making our assessments in our exam, okay? And how often do you brush? Okay. Okay. And how often do you get the opportunity to floss? All right. That makes sense. Alrighty. Thank you so much. We have completed the intake form, and I really appreciate you being vulnerable and being as honest as possible with me, alright? Wonderful. So, now that we have our preliminary things taken care of, I want to move on to our exam, okay? So, since I'm going to be really up close, I do want to be as hygienic as possible and put on my face mask as well as my gloves, alright? So I'm just going to take a moment to do that, and then we can get started on our exam. Alrighty, so now that I have my mask and my gloves on, we are just going to get you all prepared for our exam. Alright. Put this in here. Take this around. Make sure that you're all set here, alright? Great. So the first thing I'm going to do is I'm going to take a closer look at what we're working with. Alright? If this light is too bright, let me know. And I'm going to go in with my little mirror as well as my tiny little lamp, little flashlight. And that's going to give me a closer look at what's going on with those teeth of yours, alright? So I'm just going to go ahead and take a closer peek here. Alrighty, just taking a glance. Okay, alright. Alright. So everything I'm seeing seems quite normal. I'm seeing a little bit of plaque buildup, which is not surprising to me since it has been a little while since your last visit. Alright, so I'm seeing that plaque buildup, which is not going to be a problem for us at all, okay? We'll get rid of all of that today. I'm also seeing some gum sensitivity, irritation. They're looking a little swollen and red. Did you by chance floss vigorously right before coming today? That's the old trick. I used to do that as well before I got into dentistry, and I always thought it was absolute wizardry. The dentist could tell. Well, we are gum experts. But as I mentioned, there's no shame here. I totally understand, and you're not at all in the minority, alright? Alright, so the good news is I'm not seeing very much I am concerned about. Just that plaque buildup, like I mentioned, as well as some irritated gums. Because I do see that gum irritation, I do want to get a closer look and measure the depth of the gums. Deeper gums can indicate gingivitis, which is gum disease, so I just want to take a closer look. Typically, if we're seeing a lot of deeper gums, we do like to go in with a deep clean versus a more standard clean, which is what you're scheduled for today. I do have some time today, so if you do end up needing a deep clean, I'm happy to take care of that now so you don't have to reschedule. Or if you would like to reschedule and prepare yourself for this new procedure, you're more than welcome to reschedule for that, okay? So I'm just going to go ahead and take my measuring tool and we'll get in there. Okay. Alright, so once again, I'm going to take a closer look here and just measure. You may feel a little bit of poking, but it shouldn't be too uncomfortable. And if it is, let me know, okay? Alright, that's fine. That's a little deeper than I'd like. That's okay. That's good. That's good. That's a little deeper. That's good. That's good. It's a little deep, but okay. Good. Okay, now for the bottom. That's looking alright. Okay, just a little deep right there. Okay, that's good. That's good. Good. Alright. I'm just getting in here. Okay, so the good news is I don't think you're going to need a deep clean. We can just proceed with the planned standard clean, which is good. But I do see some bleeding, and as you could feel, I wasn't poking very hard, so that shows me that your gums are quite sensitive and there is some gum disease. That's okay. That's something that we can take care of today. So I'll be working on that as well as giving you your cleaning to remove the plaque from your teeth. Okay? Does that sound good? Okay, wonderful. So let's go ahead and go in with cleaning. Like I said, there is a little bit of bleeding, so I'm just gonna go in with this guy here and just get some of that. Alright, clean some of that up here. Okay, if this continues, I may give you an antibiotic once we're finished. Okay, so we're all done there. Okay, and before we begin, I'm just going to go in and get my little suction tool and put that in here so that you don't have to worry about your saliva pulling up, okay? Alright, so now let me go in and grab my cleaning tools. Okay, I know it's a little pokey, which can seem a little scary, but not to worry. I do have a very gentle hand, okay? If at any point you feel any kind of discomfort, you just let me know, okay? And I'm happy to pause, give you a moment, or adjust as necessary, okay? Alright. So right now, I'm just taking care of some of the plaque or the buildup around your teeth. And this is just to make sure that we can keep them nice and clean. They'll feel nice and smooth when you rub your tongue against them. That's always my favorite part after getting a tooth cleaned. You may feel, a little bit of pressure sometimes as I'm going in and scraping. But like I mentioned, if there is too much pain, just let me know. It shouldn't feel painful. More so just a little bit of pressure, like I said. Alright, just making sure that we're getting in on here. Have you ever gone to an evening dentist appointment before? Yes, we think they're rather unique as well. But, you know, it makes sense. Growing up, and even into adulthood, I always had dentist appointments, it seems like, in the morning. So you always had to take off school or take off work. So we figured we would offer appointments in the evenings when folks are actually free. And plus, I think it definitely contributes to a very relaxing environment, in my opinion. Alright, just wiping that on your little cover there. So how are you doing? I always like to check in to make sure that things are okay. Yeah? Like I mentioned, I work with a lot of patients with history of dental anxiety, so I know this can be a tough thing to sit through. And I wanted you to know that I think very highly of you for facing your fears and having the courage to do this as a way of taking care of yourself. So you should really be proud of yourself today. Sure that we're going to get you all nice and cleaned up here. Okay. Are you experiencing any kind of pain? Okay. Good. I'm glad. I like to think I do have a very gentle touch, but still good to keep in touch and ask, I think. What may feel too firm for one is too soft for others. Alright, so we've got the top covered. Now let's move on to the bottom teeth here. We're just gonna move around. Alrighty. Beautiful, beautiful teeth. And we're just here to take care of them together, okay? Okay. Just so you know, I am seeing quite a bit of bleeding. More than I would want, but like I said, that's normal. It's nothing to be worried about. It's something that we'll take care of together, okay? Alright. Wipe that off a little more. I know this is on your dental history, but I forgot. Did you ever have braces? Okay. And are you still wearing those retainers? Okay. Yeah, I see a little bit of crowding down here, but it's really nothing to worry about. If you don't care, I'm fine. I don't foresee it causing any issues. Alrighty. We're almost done here. Okay. Yeah, it seems like the bleeding really is focused around the molars. There's a fair amount. Not as much on the bottom as I noticed on the top, so that's good. Okay. Alright. Well, let me go in with another one of these cotton swabs and just get some more of that blood, okay? Just a little bit more than what I would like. Again, don't alarm yourself. It's not a big deal. We can take care of it all today. Alright. Okay. So I do want to give your gums a little bit of a rest before we go in with the flossing. So I just want to take a moment now and examine the soft tissue around your mouth. So that'll include your cheeks, your lips, as well as your lymph nodes, okay? And this is just to make sure that I don't sense any issues. Sometimes oral cancer can be a possibility. It's not common, don't worry, I don't find it often. But just to make sure that we're preventing any sort of issues. So I'm just gonna go around and feel around your cheek area. Okay, just feeling that soft tissue there. And if you can just close your mouth for a second so I can feel around the lips. Okay. Okay. Looking good. And now I'm just gonna reach under your jaw and feel the lymph nodes here. So I'm feeling for any sort of abnormalities. That's feeling good there. And I think this is good as well. Okay, so I'm not seeing anything of concern, which is good. So I'm glad. Of course, we always want to make sure that we're catching things early in case there is anything. So in this case, nothing to worry about. Alright, so now let's move on to flossing, alright? I always recommend that my patients use something like the Glide floss, or basically any version that's that nice and thin, flat string floss. I find that the other kind just gets stuck in your teeth, it breaks more easily. So I tend to prefer this kind of floss. And there is some debate, especially among consumers, about what kind of floss is best, whether it's a traditional string floss like this one, or whether it's a water pick. And most dentists are going to recommend an actual string floss. It's just so that you can really get into those teeth and scrape off the sides, okay? So I know a lot of people get nervous about the flossing because dentists tend to be just really rough and aggressive when it comes to sticking these into your gums, and I am not like that. that I have perfected a technique for pain-free flossing. Alright? You may feel a little bit since your gums are already a little bit sensitive, but this is the method that works for me every other time. So what you're going to do is, instead of going in and just jamming it, because what that does is that it forces it up into your gums, you're just going to gently glide and wiggle it in. And then once you're past that resistance, you can just go ahead and scrape the sides of each of the teeth, excuse me. Alright, so now I'm going to go in, and you just let me know if you have any sort of pain, if you want me to stop at any point, just let me know, okay? Alright, so we're going to scrape the sides. I don't know if you can feel that, but you just wiggle it in, go up all the way into the gums, okay? So I know it can be difficult to make sure that you're flossing every day. I know this was always my biggest issue. Growing up, I was a champion when it came to brushing, but it was a lot more difficult for me to remember to floss every day. And that continued well into being an adult, again, until I became passionate about dental care and went to dentistry school. Okay. How is that feeling? Is that okay? Okay, good. You let me know if there's anything that you want me to do differently, okay? So, one of the best hacks and pieces of advice that I like to give to my patients is to keep a pack of floss next to where you spend your evenings. So if you find yourself, on the couch a lot in the evenings, relaxing, watching TV, just keep a pack of the floss there. So you can just absentmindedly do it while you're watching television. For me, I have a TV in my bedroom, and so oftentimes that's where I am in the evenings, just relaxing, and I keep a pack of the floss on my bedside table, my nightstand. And it's really a game changer, because if it's something that you can just incorporate into what you're doing already, I find that it's a lot easier to remember and a lot less of a chore versus doing it in the bathroom. The other thing that a lot of folks have questions about is whether to floss or brush first. And I always recommend that you floss first. Floss before brushing. That is the advice that my dentist gave me, and I've been following it all these years, and that's the advice I give to everyone. So, the more you set yourself up for success, the better. I know there's a lot of shame around not being able to floss every day, and the reality is that everybody's going through something different. I know depression makes it very difficult for a lot of people to regularly keep up with dental hygiene, brushing, flossing. And instead of shaming people, I think it's much more effective to find ways to help during these periods of time where it just seems so difficult to get out of bed. So again, keeping a pack of floss next to you on the nightstand. You can even get those little disposable little toothbrushes so that you can just reach into the nightstand and grab one of those for those nights that you truly just can't get out of bed. Of course, this shouldn't be the habit. We really want to make sure that you're keeping up with your oral health as best as possible. and that you make it a habit to floss and to brush your teeth. But for those days where it's just not a reality and those are going to happen, we recommend keeping those tools on your bedside table to make it just an easy way, one thing that you can do to take care of yourself during those times. Okay, so again, I am seeing some bleeding here. So I'm just going to go ahead and irrigate the gums with an antibiotic. Okay, so it's going to look like an injection, but it's not. I can show you the syringe and the needle here. You see it's blunt on the tip, so it's not a pointy tip. This is not an injection. I know a lot of people have anxiety around injections, and it's not a shot. It's not going to go into your gums. I'm just using it to spread this antibiotic to make sure that bacteria don't find their way into the little wounds that are created there. Okay, so we're just going to go ahead, grab some of that antibiotic, and I'm going to go ahead and irrigate your gums. Again, you're not going to feel any sort of injection. It's just going into the sides. You feel that? That cool liquid? Yeah. So that's all we're doing today. It's just going the edge of all the teeth and the gum area just to flush out any sort of bacteria and to discourage them from taking root there. Alright, so we're going to do the top here. Okay, right. Really targeting these back molars. The reason we see it so often in the back is because these are where it's hardest for even the most regular of flossers to really get in there. It's very easy to skip that last crevice between those last two molars, especially on the top. They're very difficult to get to. Alright, so we're going to let that settle. And so then our final thing today is our fluoride polish. So I'm going to go ahead and grab that, open it up here, and we're just going to go on in and give you a polish, okay? Alrighty. And the fluoride really helps the strength of your teeth and make sure that almost like okay. Alrighty there. We're just going to make sure that we're getting both sides of the teeth. How are you doing? You okay? Okay, good. I'm glad to hear it. Okay. All right. And with that, you are done. We do like to see our patients at least 2 times a year, once every 6 months. But for folks that have been out for a while and who may have had, some bleeding, we do tend to prefer to see you a little bit sooner, every 3 to 4 months, if that's okay with you. That's what I personally would recommend. But if you would like to stick to the every 6 months, that is totally fine as well. Either way, your insurance will cover it. So you should be all set there. And with that being said, thank you so much for coming to me today. I know this is a big step for you, and I'm so proud of you for taking the time and being brave enough to take care of yourself in this way, okay? So of course I'm not going to let you leave empty-handed. I do have a little goodie bag for you here. And in the goodie bag we have a brand new toothbrush, as well as a mini version of this Crest Gum Detoxify toothpaste. So you can take that with you, okay? Thank you again, and you can schedule your follow-up appointment with the reception desk up front. Thanks so much, and I hope to see you soon. Bye.